In this webinar, we'll be giving you a short refresher of what the Hospice Hope Assessment is. We'll also be giving you a live demo on Alora setup items to create in preparation for the Hope Assessment. We'll walk you through a Hope Assessment and highlight some important changes, the symptom follow-up visit, and our dashboard approach to monitoring symptom follow-up compliance. And finally, we'll be opening it up to any questions you may have about Hope. Before we jump in, let's start with a poll. How prepared is your agency for the new Hope Assessment and additional time points? And I'll just give you about 20 seconds to respond to this poll. Give me 1 second here. So about a third of you are asking what Hope is, and about half of you are somewhat prepared, and about 23% are very prepared. So I think those are good statistics. Let's begin with a brief refresher. What exactly is the Hope Assessment and why does it matter to us in hospice? HOPE stands for Hospice Outcome and Patient Evaluation. It's CMS's new standardized patient assessment tool, and it will be mandatory for all Medicare-certified hospice agencies starting October 1st of 2025. Now, this isn't just a replacement for the HIS assessment. HOPE represents a shift in how CMS wants hospices to collect, document, and eventually report patient-level clinical data. Instead of capturing static data at admission and discharge like we do today with HIS, HOPE introduces multiple time points, more clinically nuanced items, and real-time symptom impact tracking, including requirements for follow-up when symptoms are rated as moderate or severe. So what's different? First, HOPE includes more than just admission and discharge assessments. It introduces HOPE update visits, or HUVs, at specific time points, days 6 through 15 for the first HUV, and days 16 through 30 for the second HUV, to help capture the trajectory of care. So HUV visits should only be performed for hospice admissions on or after October 1st of 2025. So if you have a patient that's current with your hospice agency and their admission date was prior to October 1st, you're not required to perform a HUV assessment. Second, it includes symptom impact ratings, not just does the patient have pain, but rather how much does that pain affect their daily and quality of life. And if it's moderate or severe, your team is expected to conduct a nursing follow-up visit within 48 hours. And finally, HOPE data will be used to inform future quality measures, particularly related to symptom response timeliness, even though public reporting won't start until the 2028 fiscal year. So in short, HOPE isn't just an assessment, it's a new framework. It pushes all of us towards more real-time, patient-centered documentation, and eventually it will allow CMS to evaluate not just whether we're providing care, but how quickly and effectively we're responding to the needs of our patients. Now that we've covered the background and intent of HOPE, let's take a look at how it works inside of Alora. From the beginning, our goal has been to make HOPE feel intuitive, not just compliant. So we've redesigned the hospice assessment experience with a modern design and to align with CMS's new structure while minimizing friction for your team. Inside Alora, the HOPE assessment is organized around the same core time points required by CMS. You'll have access to the HOPE admission assessment, 2 HOPE update visits, HUV 1 and HUV 2, and of course the HOPE discharge assessment. Our follow-up assessment that can be performed before the start of a new benefit period has also been updated to align with the new designs of the HOPE assessment. Based on the admission date and date of the encounter, Alora will automatically determine whether you will be completing the HOPE versus the HIS, which is especially important during this transition phase. Each one is built with logic-based guidance to help your team document accurately without having to memorize every CMS data definition and skip logic. We've also built in validations to help ensure that assessments can't be completed or locked if key compliance elements are missing. such as a symptom follow-up visit that is yet to be addressed. We've considered the flow for scheduling a symptom follow-up visit from the HOPE assessment and updating the HOPE assessment from a symptom follow-up visit. And we've updated the hospice nursing note to include symptom follow-up documentation. Finally, we're adding a new widget that will track symptom follow-up visits for HOPE documentation completion. In just a moment, I'm going to walk you through a live demo, starting with the required and recommended setup items, and then we'll review the HOPE admission assessment, symptom follow-up visit, and the symptom follow-up dashboard widget. All right. So the first thing I wanted to go over that you can actually do now to prepare, and I also included this on the handout for the checklist for preparation, is setting up your billing codes. So what you'll want to do is have billing codes for your symptom follow-up. So here I have a billing code for my LPN and a billing code for my RN for symptom follow-up. And the reason why I have one for each is because the HCPCS code for each is going to be different. So what you're going to see in the next update, you won't see this now, is when you select a discipline associated to a skilled nurse, you'll see an option here to assign this billing code as a symptom follow-up visit. There's also some tool text here to help you understand what this is for. So it says here, this option indicates that the visit is specifically for symptom follow-up required by the HOPE assessment. And these billing codes identified as symptom follow-up visits help to identify whether or not symptom follow-up visits are being completed or even scheduled based on your HOPE assessment. Some other optional billing codes you can create as well are your RN hub visits. Here I created 2 for Hub 1 and Hub 2. You may just create 1 for one hub. One thing important to note here is even identifying the document type as an assessment. That way, when they start their visit from the dashboard, it automatically routes them to create an assessment. And the final setup item that you'll need to do once the release has been provided or in production is to make sure that whoever needs access to the dashboard widget for symptom follow-up, who's monitoring those symptom follow-up visits, has that widget enabled in their User Security Manager. So here in User Security Manager dashboard, the very last item you'll see here is Show Symptom Follow-up widget. All right. Now let's go ahead and take a look at our HOPE assessment. So here you can see I have my visit scheduled October 1st, my hospice RN assessment, and my hub visits as well. So I'm going to go ahead and start a hospice RN assessment here for my patient, Miss Anita Follow-up for October 1st. Here you can see that it automatically routes me to my HOPE assessment. All right, so what I kind of want to bring to your attention right off the bat is the new modernized design for the HOPE assessment. What you'll see here is the patient header. It has some demographic information in here. It also drops down. You can expand it to reveal more information, the phone number, gender, emergency contact, address, physician, DNR allergies, and even some quick links to open in another tab if you wanted to open the admission. Maybe you wanted to add a, I don't know, custom document, electronic health record, or review the patient's chart. You can have quick access from there. Also a quick link to the med profile as well as the scheduler. So here I'm going to go ahead and create an admission HOPE assessment. And what you'll see here on the menu bar is that it also has an improvement as well. Every sub-tab option is now going to be available from the main menu bar. The first thing I wanted to bring your attention to is actually in this tab, because the first new question is going to be located here, and that is the A1110 for language. So here it's an open free text to type in what the preferred language is and whether or not an interpreter is needed. If I move over to the next tab, what I wanted to show you was kind of some improvements that were made to the advanced directives with the smart UI here. So based on your responses, it may show or hide additional questions. So in advanced directives, if there's no advanced directives, it gives me these 2 additional questions. If I select yes, then it does expand and allow me to give more detail about any advanced directives. The next item, I'm not going to go through each tab. I'm just going to go through a lot of where you're going to see some major changes, because a lot of the assessment questions are pretty much the same. The controls may be different, but it'll be like the same question. So here on the active diagnosis tab, this is one of the major updates to the questions that already exist, and this is the principal diagnosis, I-10. Before it was just 3 options to select for the principal diagnosis, but they did expand that list to include additional diagnoses types here. And also it has been updated to identify any comorbidities and coexisting conditions as well. One thing I wanted to take note, for those that were not fully understanding what the terminal status determination and principal diagnosis criteria are for. So the principal diagnosis criteria is actually driven by your selection here for the principal diagnosis. And since I selected cancer, it selected the principal diagnosis criteria. So these 2 sections are actually pulled from the local coverage determinations, or LCDs, for determining terminal status. So this information helps to strengthen your determination for hospice eligibility. All right, now I'm going to jump to family support, just to highlight the new questions that are available here, which is A1905 for living arrangement and A1910 for availability of assistance. The next tab I wanted to highlight, which I think you guys would really enjoy here, is the pain assessment. So what we've done with the pain assessment, it's also a smart interface here. If I select no, I can just add comments, but if I select yes, then I'm able to do a comprehensive pain assessment where I'm able to identify a location for the pain. But not just that, but also add an additional pain location. So what you'll see here is the location of the pain will actually be included in the header there, and it's already collapsed. But you can add multiple pain assessments if there's multiple pain locations that you need to document. Also on this tab, we did include the new HOPE question here for neuropathic pain. In the neurological section, the one thing that I wanted to kind of highlight in here, we did make some improvements on documenting the mental status for oriented and disoriented. Instead of just saying ×2, ×3, you're able to identify that they're oriented to person, place, and time, or whichever. Now for the fun stuff. Symptom impact. So if a symptom impact screening was completed, of course, you select yes, and it does expand and show the additional options. If I select no, then based on skip logic, you just go on to the next question. So I'm going to select yes here and say that the symptom impact screening was performed on the date of the scheduled visit here on 10/1. And this is kind of a new control as well. It's the sliding scale. So you have 0 to 3. 0 saying that the symptom does not affect their quality of life at all, versus 3 where it has a severe impact. And if it's not applicable, then you could select the checkbox. You can click on each one as well, or if you have a touchscreen, you could also slide it. So let me just kind of show you here if I mark these as not applicable. If I selected a symptom impact or two or three, we do have the ability here to schedule the symptom follow-up visit for this patient. So it'll open it up in the scheduler. And this button will only be accessible if the user that is completing this assessment has access or full access to the scheduler. So if I click on this, it opens up the scheduler. The billing codes are only going to show me billing codes that are related to or assigned as a symptom follow-up visit billing code. And there's also some validation logic here as well. So if I scheduled outside of the 48-hour window of the J2050, it tells me that it exceeds the 48 hours of the symptom impact assessment. So that's some really cool validation logic available there. Once the visit is done, you actually have the ability to update your HOPE assessment from the symptom follow-up visit, and I'll demonstrate that in a little bit as well. So we're going to take a look at this in a little bit once we review the dashboard information. So I'm going to move on and look at the new HOPE improvements here. So integumentary, what we've added is the ability to see the wound history from your HOPE assessments as well. Also, all the new skin integumentary questions are available here as well. MU 1190, MU 1195, and MU 1200. So if I select yes, these options become available. And if I select no, then I can proceed to the next tab. The SN Synopsis tab, we've added the ability to create the aid plan of care from your HOPE assessment as well. So if the patient did not refuse, then I have the button available here to create my aid plan of care. All right. So those are kind of like the highlights of the new HOPE assessment. Now let's take a look at the widget. I collapse these here. So this kind of introduces a new design for widgets as well. So you'll probably see our widgets start to improve with a more modern design. So this is the symptom follow-up due widget. And here I have a total according to each status. So I have 2 that are not scheduled. I have 1 that's scheduled. I have 1 that's in progress and 1 that's pending HOPE update. So these are also filters. So if I click here, then I'm only showing the symptom follow-up visits that are not scheduled. And what this widget looks for is it looks for any HOPE assessments that are not complete, so that they're in use and they require a symptom follow-up visit. And it looks for a symptom follow-up visit within 48 hours of that J2050 date of symptom impact assessment. So this is also expandable as well. You can see now it shows me that this is associated to an admission assessment. The J2050 date is 10/1. So I do have a symptom follow-up visit that is due on 10/3. And if I did not schedule it from my assessment, I can schedule it from the dashboard widget. If we look at scheduled, we could see that we have a symptom follow-up visit scheduled on 10/3. Scheduled means there's no document attached. It's basically a not completed status. So from here, I'm able to edit the symptom follow-up visit appointment, or I can navigate directly to the HOPE assessment from here as well. The next status here is in progress. So this means that I have a symptom follow-up visit that is scheduled, but not only is it scheduled, there is a document that's already been started, but it has not been marked as complete. So it's letting us know that it is in progress. One thing to note is when you do update a HOPE assessment from a symptom follow-up visit, you want to make sure that that visit is marked as complete, because it does carry the signature over into the Z400 section of the HOPE assessment as well. So here I have a symptom follow-up visit that is marked as completed. So all I have to do is update my HOPE assessment with that information and complete it for it to drop off of this widget. But before I do that, I wanted to show you the symptom follow-up visit itself. So here I have this patient here, Miss Diarrhea. It's because she has a symptom impact for diarrhea here. So for this patient, when you start a visit associated to a symptom follow-up visit billing code, it automatically assigns the visit type as symptom follow-up visit. So this will be a new visit type that you'll see on your hospice nursing notes. And if this is checked, what you'll see is a new tab just for symptom impact. So you can see if I uncheck that, that tab disappears. And if I check it, that tab comes back. The symptom impact tab actually contains the elements for J2053 to complete your HOPE assessment. So it contains the same sliding scale here as well. And again, you want to make sure that the note is signed so that that information flows over to the HOPE assessment for the Z0400. All right, so now I'll show you how to update the HOPE assessment from a symptom follow-up visit. So I'm going to look at my pending HOPE update here. I want to open my HOPE assessment. As you can see, the symptom follow-up visit appointment management shows the scheduled date and the time and the status of the note as well from here. And if I click Update from SFV, it updates J2052 and J2053. So J2052 identifies whether a symptom follow-up visit was completed within 48 hours and the date of visit. And then J2053 is the symptom impact reassessment here. And what you'll see as well on the signature tab in Z0400, that the signature carried over to this section as well. That's pretty much it for the new functionality. What I kind of wanted to mention as well, when you're scheduling your frequencies for your hospice patients, I'm sure you all know this already, but when you're scheduling a recurring, you kind of want to schedule the majority first. So I'm scheduling a recurring series for my hospice RN routine, and then you want to make sure that you update the visits from days 6 through 15 to have a HUV1, and then your days 16 through 30 to have your HUV2. That way you don't forget to complete those time points. So by now you may be thinking, what should I be doing today to get ready for HOPE? So here's some things you can do here. You can download the CMS HOPE guidance manual. I recommend kind of reading through that, especially some of those new questions, understanding the strategy on how to respond to those questions. Take advantage of the CMS Train the Trainer program. It is a guided program to help you understand the HOPE assessment and how it impacts hospice care. I've included links to these, access to these on the reference page as well. Begin educating your RNs and IDT members now, focusing on the major shifts like symptom impact scoring, HOPE update visit timeframes, and symptom follow-up visit requirements. Consider implementing symptom impact screening now if you're not already. So the clinicians get used to identifying when a follow-up visit within 48 hours is appropriate. CMS has already identified this as being a best practice for high-performing hospice agencies. And set up your billing codes to identify symptom follow-up visits for an RN and LPN. Also consider creating billing codes for hub visits as well for your RNs. And don't forget that there is also a downloadable checklist in the handout section of the GoToMeeting as well. Before we wrap up completely, here are the key resources to kind of support your ongoing preparation for HOPE. And if you haven't done so already, don't forget to download the presentation in the handouts area as well as the checklist. And if you happen to have missed that, shoot me an email and I will get that information to you as well. And on behalf of all of us at Alora Healthcare Systems, we appreciate the work you do every day to provide that compassionate, high quality care to your patients. So thank you again for joining us today. Y'all take care.